In 2010, Dr. Jamal Rifi was a national finalist as Australia's local hero for the Australian of the Year. In January 2015, he was chosen by the Australian newspaper as its alternate Australian of the Year. When he was announced as the winner, he was praised by senior politician Scott Morrison, who said that Dr. Jamal Rifi is a great Australian. In 2017, Dr. Jamal Rifi was awarded a Medal of the Order of Australia. Last year, when COVID hit, Dr. Jamal Rifi set up a drive-through COVID clinic in his own front yard. He also worked with the Bulldogs to set up a drive-through vaccination clinic. Dr. Jamal Rifi has been praised for his efforts during the pandemic by Scott Morrison. Hi everyone, today I'm with Dr. Jamal Rifi, who has played a very important part in the COVID-19 vaccine rollout. Let's get started with the questions, shall we? Alright, first question, Dr. Jamal, is are the COVID vaccines working?
Absolutely working, 100%. They are safe, they are effective, and they protect the patient, the family, and the community so they don't get COVID-19. Now, get the COVID-19 after vaccination, it comes very mild. They don't end up in hospital, they don't go into ICU.
Alright. Now, second question, doctor, is how will booster shots help us?
We know that after the second vaccination, people will have immunity. But 6 months after that, that immunity starts to wean down, to get lower and lower. By giving them a booster vaccination, we protect them, protect their loved one, protect the whole community, and most importantly, if and when winter comes in, they still have a high level of antibodies that will cover them against COVID-19, and hopefully soon we know that it's covered them for the Omicron and the Delta variant.
Dr. Jamal, what is the difference between the Astrozenica vaccine and the Phasor vaccine?
They're both good vaccine. They're both effective vaccine. But unfortunately, the AstraZeneca reputation took a hit because initially we didn't promote it very well. We didn't tell the patients about the potential side effects. And unfortunately, some people died from the AstraZeneca. Now we know that most vaccines have side effects, but we don't want anyone to die from the vaccines. Now we have a very good experience in using the AstraZeneca for people who they don't have any high risk for developing the syndromes of blood clotting. We are better now. We developed a lot of experience with it, but both of them are very good. I had 2 AstraZeneca and I'm waiting now patiently to get my booster of the Pfizer vaccine.
Doctor, do you believe the COVID vaccine is important for a child like my age?
Without any doubt. We know now that the Delta variant transmits very easily. The Omicron transmits even faster than the Delta variant. People who are vaccinated, we hope that they are protected for it. But people from 5 to 11 years old, they're not vaccinated. So they can harbor the virus. It might not affect them severely themselves, but then when they go home, they see their grandfather, their grandmother, they transmit that virus. So that's why it's very important, based on the clinical data that we have from USA and from Israel, and from Canada, where they vaccinated the children. We know it is safe, it is effective for children, because unfortunately some kids who get the virus, they have a syndrome where they will actually suffer for long term for it. It's not a majority, but it can happen. So which is better is to give them that cover and protect them by vaccinating them from 5 to 11.
Right. And saying that, do you know any news on when kids age 11 and younger can get the vaccine?
We definitely know for a fact that has been approved by our scientists in Australia, and the government is going to start rolling out the vaccine on the 10th of January 2022.
Dr. Jamal, can the COVID vaccine impact on other medication I may be having?
Look, definitely, like any other vaccine, there is a potential of side effects, and also there is a potential of interaction. In clinical aspect, we found that it is safe and effective. It will only affect some people who have a high risk of anaphylactic reaction, but even these people who are highly allergic, that there was some studies that proved in the right circumstances they can get the vaccines.
Doctor, has any Australia made a vaccine that has been sent to other countries?
Yes, what happened is the Astrozenica was developed in the UK and Sweden, I think, and it was produced there. But the Commonwealth Serum Laboratory, which is CSL, started to produce the Astrozenica in large quantity. And I know our Australian government made a promise that actually the AstraZeneca that is produced in Australia and the surplus that we have, it will be sent to third world country, and it has been sent to Fiji, Papua New Guinea and other countries in our neighbors in the Pacific, and they are benefiting from it.
Dr. Jamal, is there anything you would like to say to those who are worried about taking the vaccine?
I reckon they should be worried about the virus itself. This virus is a deadly virus. The vaccine actually protects them, and it has been proven that those who get the vaccine, even if they get the virus becomes mild. My advice to them is to speak with their general practitioner, to trust our scientists, and not to worry about too much misinformation and lies on social media.
So that wraps up all of our questions for today. Dr. Jamal, it was my pleasure having you today, and thank you for taking out your time for this interview today.
Let me tell you, it's my pleasure to see you, so give me 5. Thank you guys.
Thank you.
Hope you listen. Hope you get your vaccine.